This is episode 10, When the Medical Oncologist Gets Cancer. Welcome to the Recovery Room podcast. Today we meet retired medical oncologist, Dr. Leona Downey. Dr. Downey dedicated her career and medical practice to the care of people with breast cancer. And then she, unfortunately herself, was diagnosed with breast cancer, going from medical oncologist to cancer patient. Please join us for this insightful conversation where we talk about how her being a cancer physician made her experience easier, how it made it harder, and then I ask her about the shock factor and if she thought somehow she was immune from getting cancer. I asked her, what did your friends think and how did you relate to your physicians? And now that you know what it's like to be a patient, what would you do differently as a physician? And ultimately, I ask her, if you had the opportunity to write a letter to cancer, what would your first few sentences be? Whether you are podcast watching or listening, I appreciate you being here. I'm cancer physical therapist, Dr. Leslie Waldke. Please hang around until after the show to learn how you and I can engage directly in my incredible cancer survivor membership group called Recovery Room Plus. This is the Recovery Room podcast, discussing all things cancer and cancer recovery. We bring you the experts' accuracy, understanding, and next steps you need to be healthier, more confident, make better decisions, and live your best life after cancer. All right. So today we are talking about when the physician becomes the patient, and not only physician becoming the patient, because that, everybody gets hurt regardless of what your job title is, but when medical oncologist becomes cancer patient. So Leona, unfortunately, welcome to the Recovery Room podcast, because this is you. Yes, great. Yep. So you are a retired medical oncologist and then got breast cancer. So, I just from talk about both sides of the bed rail. So I think it's your perspective is going to be fabulous to learn about, but just tell us about your cancer diagnosis and treatment. Give us the rundown on what you went through.
Yeah. So I had retired. I decided to retire kind of young, just wanting to focus on my own general wellness and stuff a little bit. So I had retired about a year before I was diagnosed, and I was doing all these great things and, doing yoga and eating healthy and getting myself in shape. And then all of a sudden I felt this breast mass that was enlarging. So I had a chronic, like a benign breast lump for some years and had it evaluated. They said it's a fibroadenoma. It's fine. No problem. So it started getting bigger, or what I felt started getting bigger. And I thought, it's that fibroadenoma. And it just kept getting bigger and bigger. And I was 39 at the time. So I was not quite 40. So I had not gone back for another mammogram. It had been a few years since I had been diagnosed with the thing. So it kept getting bigger, bigger, bigger. Finally, I felt a lump in my underarm. I felt a lymph node. And that's when it's not the fibroadenoma. So
right. Did you just get sick to your stomach? Or, I would have just shit myself had I felt that.
That's what happened. I just was like just the energy dropped out of me. I was like, yeah. God, here we are,
Yeah. So we'll talk about things that, being a physician makes it easier, but some things makes it harder. That had to have been a lot harder knowing what that probably was and what that probably meant. So, okay, go ahead. So go on with your treatment. What'd you do?
I can actually feel in my stomach now, just telling the story.
I bet. Yeah. The old PTSD does. Yeah.
Yeah. Yeah. So it was like right before I turned 40. So I went for the mammogram, but I told them, I have a mass, I have a lump in my underarm. I was here in Mexico at the time. So I went, there's actually pretty good, really good medical facilities here. So I went, had a diagnostic mammogram, had the ultrasound. They have a doctor there, a surgical oncologist, and he comes in and he's like, I think that's a cancer. And I was like, yeah, I know. But he was so concerned, so surprised that this situation would be coming up. So, So I knew what it was, but had the diagnostics, went back the next week for the biopsy. And it was an aggressive HER2 positive, estrogen negative cancer. So one of the most aggressive biologies, not the very most, but up there, aggressive biology. And
so I always say congratulations. You got the worst of both worlds.
I'm like, awesome. We'll talk a little bit about the good and bad, the sort of double-edged sword, maybe in a minute. But so at the time I had the biopsy, I didn't know the biology yet, of course. You find that out a little later. But I knew whatever it was, what had spread to my lymph nodes. I had like at least 4 enlarged lymph nodes on the ultrasound. So I go home, I'm waiting for the biopsy results. I know it's cancer, but I don't know what kind yet.
Right.
And I got to tell you, that was like the worst week of my life.
Jesus.
I'm not a very patient person anyway. And, just having been in the medical field, I thought like, they should have this done by now. In America, it only takes 3 days or, whatever.
Right.
And used to, I could call the lab, right? I could call the pathologist and be like, hey, find this person's stuff. But I didn't have that power now, right? I'm waiting like everybody else does. And it took a little bit longer than it normally would have in my practice. So anyway, finally, about a week later, I find out the biology. I find out it's HER2 positive. And truthfully, that was one of those double-edged swords. It's like, it means it's very aggressive, but it also means there's good treatment for it, Herceptin and those type of drugs. So in a way, I was relieved, but I also was like, this is serious. This isn't like just a simple thing. So, at that time, I called my best friend in Tucson, who I had practiced with. We had been girlfriends ever since residency. She was also a breast cancer specialized oncologist. Called her, said, I have this positive cancer. It's node positive. I need to start treatment like next week. And so she said, get your butt on a plane, get here. We'll start you next week. I had to have a couple of other things like a whole body PET scan and stuff like that. We arranged all of that.
Sure. Yep.
So I flew to Tucson to get my first chemo because I just didn't want to waste any time. And that was great. It all went pretty smoothly. But then, I live in Mexico, so I wanted to get the rest of my treatment down here. So after the first chemo, I came back to Mexico and I was like, okay, I'm going to find an oncologist and see if they can get the drugs that I need. Because it's this complicated combination,
Right.
A lot of the audience will know this stuff. It's Taxotere, carboplatin, Herceptin, and Perjeta, which was like state of the art at the time. And I was like, maybe they don't have it in Mexico. So long story short, I find this oncologist here who's lovely, by the way. I ended up being very good friends with her. And I went to see her. And, I was my own sort of neurotic self. And I was like, I need this, and I was trying to boss the situation, and she was like, you're going to need to calm down a little bit and let me take care of you. And that was the beginning of a long friendship. And so she did. And so I had the rest of the chemo here in Puerto Vallarta. And fortunately, I was very lucky. The cancer shrunk rapidly with the treatment. And then I ended up going back to Tucson for my surgery just because I knew the surgeons there and I was more familiar with exactly what happened. So I decided to have a bilateral mastectomy. And I was very lucky. All the cancer was dead. So they took it out, took some bunch of lymph nodes, and all the cancer was dead. So that was very good. But I ended up having radiation anyway, because the mass was really big. And because of the positive nodes, the radiation doctor, who was also an old friend of mine, they recommended radiation. And I was like, I really don't want it. I don't want the radiation. But all my friends, ganged up on me and convinced me to do it. So I did it because I thought, I don't want to look back. And, if I recur years later because I didn't do something.
Right.
So anyway, that was that. That's been 7 years ago. And I'm lucky to say I'm well now.
Yeah, you are cancer-free, sister.
Yeah.
I love it. All right. So, I know everybody, intellectually knows that your job title or the initials behind your name don't make you immune from disease, including cancer. But boy, that had to have felt weird to, especially being so young, having MD after your name, and then having a pathology report with breast cancer on it. So did that feel, how did that, did you feel immune? Did you feel like, everybody's like, what the what? But was it extra weird, or how did you, and then how did you tell people? Did they give you shit for this isn't supposed to happen to you?
Yeah, it was super extra weird. It felt so ironic because, I specialized in breast cancer. That was basically all I treated. It wasn't like, that was one part of what I did. All I did was breast cancer for my entire career. And then that's the one I got. I guess I always thought like, maybe I'll get stomach cancer or I'll get bladder cancer, but I didn't think it would be breast. And then it was. And yeah, it was super weird telling people. I mean, telling my family members and telling my husband. That was horrible. But I guess the good thing is, and a number of people said this, they said, well, I guess if anybody has to get it, at least you know what you're doing, and you know what to expect, which was true in a way. So it was painful for me to tell everybody, but I think they all kind of thought like, well, you'll be okay. You know what you're doing.
Right. Which again, we'll talk about the pros and the cons, but it's like, you're still a patient. This is something you've never done before. It's a complete unique perspective. So to minimize that, just like, oh, you're a doctor, you'll be fine. It's like, well, no, that's not fair. Yeah. So let's talk about, the things that so your educational background, your experience as a medical oncologist, how did that make it better for you?
Yeah, it made it easier because I knew what to expect. Like most patients, when they come walking in, I mean, they have no idea what's going to happen. They don't know how many tests they need or what the timeline is or what comes first or next. So, I knew, okay, here's the regimen. Here's what happens. Here's what the usual side effects are. Here are the medicines that help with the side effects. So I knew what to expect, which was really helpful. But I also knew the worst case scenarios. Not only had I seen a lot of women do very well and be cured basically of even the sort of aggressive cancer that I had, but I also saw the other side, and I lost a lot of patients, and I saw sometimes the treatment doesn't work and, the very worst case thing. So that was always in the back of my mind. I don't know if I would say more than another patient, but maybe just because, I had the real images of these women.
Yeah. You see both sides of the bell curve. When you are on the curve, you only see what you see, right? And you can maybe talk to other cancer survivors, but you see what you see, but you have no idea that, literally millions of people go through cancer treatment on this planet and a million different things can happen.
Yeah.
So when you know what those million things are, that just can't be pleasant.
Yeah. And I had a few, certain women's faces just, seared into my memory. And so it was challenging.
So did, again, you as a physician, how were your relationships with your physician? You already said that your medical oncologist had to kind of put their hand on your shoulder and say, you know what, I'm in charge here. But was it intimidating to other people to take care of you, other than you're just a bright, aggressive person, you want to do well, but how were your relationships? How did you pick your docs?
I think the relationships were really great. I think, I don't think it was intimidating for any of us. I think it made it easier almost because you can just speak very clearly and very freely.
Right. Yeah. Let's get to the point. Yep.
Yeah. And you don't have to explain anything. There were a couple of times where, like, for example, at one point I had to have a blood transfusion and I didn't want to have the blood transfusion. And it was that same oncologist was like, look, you're really anemic. Come on. And then I'm like, oh, okay, you're right. So there were a couple times where I was being resistant, but they usually could convince me of, what was best for my own well-being. But yeah, overall it was very easy and, respectful. I respect what they do. And so I was very appreciative of, them being so responsive and being so kind of like they would work with my schedule if I had to change something or, insurance snafus were so frustrating. And like, I'd have to delay my chemo because the insurance was being stupid. And I always felt very blessed at how well they took care of me.
Yeah. Yeah. Because again, being the initials after your name your insurance company doesn't really care.
Yeah, exactly. Like, whatever.
The pathologist lab can't speed stuff up. So yeah, how other than knowing the worst case scenarios, how else was your history and your experience make it harder on you, do you think?
I think some of the things that were interesting and challenging were like, when I took care of patients, I thought that I was really empathetic and I really listened and I really understood what they were going through. But then when you feel it yourself, it's different. And so, a few side effects like just this gastrointestinal sort of like awful searing pain I had in my entire gut, I never understood what that was, until I felt it. And it's one of these things where like there isn't any medicine that really makes that better. That just isn't. Like none of the stuff.
Right.
And I used to, I'd prescribe, I'd be like, oh, okay, you have that. Well, take this and that. And I thought that it would work, but like it just doesn't. And so some of the stuff you just have to wait until it heals. And this is a place where, I love mindfulness. I'm super into mindfulness on all these practices. This is one of the places where I started to learn other ways to help me deal with the situation. Right. So yeah, that was eye-opening. And I learned a lot, through that sort of experience of like, you can't just take a pill and it fixes stuff, right. That's not how it is.
Right. Yeah. Yeah. So then I know that you're not treating patients anymore clinically, but when you look back, what would you do differently? Yeah. So many things. If anything.
Maybe the two main things that I think I could have done a lot better. The first one is educating patients about things like mindfulness and these sort of mental health support things that can really just help you navigate the process better. You and I talk about this all the time, and it's like, you can't make the cancer go away by doing mindfulness, but you can make it easier to navigate, and you can make it, less suffering as these people go through whatever they have to go through. So I would have been much more proactive at really encouraging patients to do stuff like this, like mindfulness practices and yoga and things like that.
And physical therapy.
Exactly. That's what I was going to, that's my number two.
That in there too.
The second thing is I would have understood so much more about the physical things that happen. Like, I had a full axillary node dissection and radiation. And so I have a lot of impact in my shoulder and my chest. And I remember patients complaining about that. And I remember thinking, well, yeah, that's, you had this stuff happen to you, but I don't think I really understood quite how much it impacts your life and quite how much something like an oncology specialized physical therapist can help you make it better. Like it really can get better. So I would have been more proactive in that way too. Like, look, you don't have to suffer with that. Go see these people. They'll help you to heal that.
I have had multiple medical problems and been very sick myself. And again, it completely changes the way I practice and the way I approach patient care, especially as a PT, because a lot of the stuff that we do is uncomfortable or can hurt or is hard, right? Yeah. I always give the cancer surgeons a hard time. I'm like, you know what? When you hurt people, they're asleep. When I hurt them, they're awake. Yeah. And it's a completely different skill set. But anyways, one of the things that I always encourage patients, either when they're meeting a physician or picking a physician, is especially a surgeon or somebody that's going to be shorter term, is, how, you're taking care of me good now when we're meeting and we're getting planning and we're setting everything up. But when it's done, when we're done with the surgery, how well are you going to take care of me? Or if things don't go well, who's going to take care of me? Are you going to take care of me? Or who is? And how well are you going to do that? Because people are so focused on the upfront, and most times things go well, but sometimes they don't. All of a sudden that doc is gone. Yeah. And that's really frustrating for people. So that's kind of one of the things I put on my list about what to ask. That's not your traditional, what are you going to do? Why are you going to do it? So do you have any tips for people when they're either communicating with physicians or meeting a physician or picking a physician? Yeah,
I think it would be very much communication, and don't be intimidated, and don't, just feel like you have to just do whatever they say. Right. You have some inner wisdom and what's best for you. I don't want to say like, just blow off whatever the doctors say, because they do have all this experience and they know the science, but to verbalize and explain where you're coming from and make sure they understand you as a human being, and what your priorities are. And that helps you, make choices.
What are your priorities? What are your goals?
Yeah. And just, and really letting the doctor help you by you explaining where you're coming from,
And most physicians will actually want that. And even, nurse practitioners, PTs, physician assistants, people will actually appreciate that and want that, because they're like, okay, you don't know who I am. I don't know who you are here. I'm giving you all this really in-depth information, making literally life-changing decisions about stuff that you probably don't know a whole lot about. So when you are an active participant in that joint decision-making, shared decision-making, it makes your world better, it makes their world better, and that is going to ultimately make your own world better. So yeah, that's a really, really good tip. Really good tip.
That's a super good point. I always used to tell patients that were like looking for they weren't going to fire me, of course, but they were looking for maybe a different surgeon or something. And I would say, you really have to trust each other. You have to trust the doctor, and the doctor has to, you have to have this good relationship for it to go well. So yeah, finding someone that you feel comfortable with, that understands what you're trying to do, and you understand why they're telling you what they're telling you. Doctors aren't just trying to be bossy. Like, they're really trying to do what's best for us.
Yep.
But sometimes there's misunderstanding. So yeah.
And I always say too, they'll never allow you to make a bad decision without telling you about it. If you choose something that they really honestly say that is not in your best interest, that is not in the best interest of this particular cancer or of your life expectancy, of your health, they're going to let you know. And again, nobody can make you do anything. A physician can offer you treatment, and it's your choice to choose it or not. But again, they're not going to let you make it. If you're making a bad decision, they're going to let you know. Some people are like, oh, I don't know if I did the right thing. Well, I'm like, unless somebody was screaming at you saying, this is really dumb, I don't recommend this, then you did the right thing. Yeah. So, all right. So one more final tip, as a patient and former physician, what do you think people are missing that could be really helpful?
Yeah, I think the last thing is just to find a way to get some support. We're all so independent, we're so strong, and we do everything. We take care of ourselves. And one thing that I really found out, it was a big spoonful of medicine for me, is, sometimes you need to accept help. And whether that's just some help from your loved ones, or you need like peer support, maybe you need to meet some other cancer survivors so that you can find people who understand what you're going through. I think it's really important that we not feel like we're going through this alone and we're the only one. So I would say, find support, let your family help you, let them do things for you. You usually do everything for everybody else, right? Ask for some help, and find some people that can support you.
All right. So Leona, when I talk with cancer survivors about their experience, I will often ask the question to wrap up: if you had the opportunity to write a letter to cancer, what would your first few sentences be?
Piss off.
I love that.
I don't know.
Capital letters.
I tried to keep it like sort of as PC as I could. Piss off. I'm not even sure I could address cancer in a letter. I wish I could write a letter to our bodies that would help us live in a condition that would not be amenable to cancer, for example. Like, I could say to our bodies, please learn how to be better and balanced, or be healthier inside, so that it's harder for cancers to grow, or things like that. I'm speaking to my body, its ability to be in a healthier place. I just want the cancer to piss off.
Yeah, that's fair. I get a lot of those. It's one sentence. There's a short 2-word sentence. That's absolutely fine. Oh, that's good stuff. Well, former Dr. Downey / Leona, the cancer survivor, the kick-ass, piss-off cancer survivor. Thank you so much for your wisdom and sharing your life experience and your personal experience from both sides of the bed rail. It's always a pleasure to have you on the show. So thank you so much. Again, watch for the rewind, everyone. It's coming up, and we will see you in the next Recovery Room podcast. Take care, everyone. Bye. I love having you in my listener community. So if you haven't already, please follow and subscribe to The Recovery Room on YouTube and Facebook, and to The Recovery Room podcast. Please share these wonderful free resources with your support groups, family, friends, and medical teams. I also have an incredible cancer survivor community membership group called Recovery Room Plus. I'd love for you to consider joining. In Recovery Room Plus, you get direct interaction with me, in-depth cancer recovery info and experts, and really awesome live events like yoga, book discussions, cooking demos, member meets, and more. I would love to connect with you. You can learn more at recoveryroompplus.com. The link is in the show notes. Takeaways from episode 10. Cancer can and does happen to anyone. In this case, it was a super healthy medical oncologist that specialized in breast cancer that got breast cancer at a young age. I think the greatest advice, she tells us, is to seek out family and friend support, medical support, and especially peer support. We are all human, which means we carry an innate fragility that can so powerfully be exposed by cancer. But humanness also carries with it an incredible resiliency of spirit. Feed your spirit with peer support, good information, and well-deserved self-care. I'm Dr. Leslie Walke, signing out from the Recovery Room podcast. Let's talk again soon.